on the web, and in your hands. This is MDiTV.
It's a decision families and physicians dread. Is it time to take the car keys away from mom or dad? Does failing eyesight or growing confusion present a danger to themselves or others? And then what happens? In car-dependent communities, no keys can mean a kind of house arrest. It's a tough spot indeed. But there may be some help navigating this driving test. A program developed in California called Road Safe Seniors is trying to help family physicians and others do a better job of figuring out when it's time to shred a driver's license and when the problem can be treated. The developers of the program tested it on almost 1,000 older drivers. 1 out of 5 had a problem, but half of those could be treated. Many of the rest, however, failed tests for signs of dementia, and in California, doctors are required to report dementia to the DMV. Dr. Marianne McKennett, a family physician at the University of California at San Diego, went through the Road Safe Seniors training. She says one of her patients, a 77-year-old, was nervous about answering the test questions at first, but ended up passing just fine. And they got it all done during a routine checkup.
The fact that this kind of screening is something that we should be doing anyway, the mental status screening, that actually this draw clock and what we call the mini cognitive screen is actually a very efficient way to do that screening anyway. So that I think that this does fit pretty easily into a regular visit for the elderly. Part of the screening can be done while the patient is waiting for you, so that you can actually, you can explain it to the patient and have them be working on that while you're seeing the other patient, or you can actually ask your medical assistant to get the process started.
This isn't the first attempt to find better ways to figure out when it's time to take the keys from an older driver. And Dr. Richard Maratoli, who directs a geriatric assessment center at Yale New Haven Hospital in Connecticut, says it's still hard to figure out when health problems impair drivers, and also who's responsible for making the decision about the ability of an older driver.
Again, it's a tricky question because the question is, the ultimate question is how much of the responsibility is the role of the licensing agency as opposed to both the driver and then the physician. Where does that sort of fit in? And I think part of it is the recognition issue of the conditions that put people at risk. Translating that recognition to driving risk is a difficult thing for many physicians to do, and ultimately probably is where the state should come in.
For now, most families turn to a physician for advice, and so training doctors to make more accurate assessments of older drivers will help settle the hard question of which drivers need to put it in park and which seniors can safely keep on trucking.